What's going on, guys? My name is Travis with travisprice.com. I am an insurance agent in the state of Michigan that specializes in Medicare and Medicare private insurance. I wanted to touch base with you and go over this article with you. Basically, what it's about is Medicare making a change to this gentleman's coverage after he had to go to 5 judges or 5 levels of appeal in order to win coverage. So I'm going to break this up into 3 parts. The first is we're going to talk about this gentleman. His name is Sean Bear. What happened to him, kind of the things he had to go through, and what happened with his drugs. Then we're going to kind of talk about the overarching effect of this situation where his drug actually switched Medicare parts and how it affects most people in the Medicare space. And then I'm going to give you my personal suggestion for Mr. Bear. If I was his insurance agent, what I would suggest him to do. And if you like this type of content, please don't forget to hit the like and subscribe button and the bell notification so you get information when I post. So let's jump right into it. So this is Sean Bear. He is under Social Security disability. He had a car accident. There was a deer that jumped in front of his vehicle. To dodge the deer, he hit an embankment. He woke up paralyzed from the waist down. At the same time or afterwards, this gentleman really got into getting into shape where he could, and he was going to be he was going to try to do the Paralympics. In that time frame, he actually was diagnosed with an autoimmune disease that shuts down the nerve endings and can make him further paralyzed. He noticed it when his fingers his hands started getting numb. So with Mr. Bear, they ended up putting him on a drug called Hizentra, and it reversed his symptoms almost immediately. When he was discharged from the hospital, it appears that he had some skilled nursing care in his home. Because this drug is an infusion drug and a nurse was giving it to him, his cost was actually falling under Medicare Part A. So he wasn't paying anything out of pocket for that because he had already had that hospitalization deductible completed. So what it appears like is that Mr. Bear is on original Medicare Parts A and B, doesn't have a Medicare supplement, and has Part D, which he can enroll in. After the nurse stopped doing the infusions in his home and he was able to do it himself, his drug switched over to Part D. They refused to pay for it. He had to go through multiple appeals up to going to a judge who finally ruled in his favor that they were responsible for this drug. At the time, he was getting some hardship waiver from the drug manufacturer, so he wasn't paying nearly as much as he would usually pay for that drug. And then Medicare sent him a letter a few weeks later, or a couple of months later, letting him know that his life-saving drug, Hizentra, would leave Part D, which is private insurance, and go to Part B, which is under the Medicare program itself. So this gentleman is a disabled person, and the first issue, he doesn't have a Medicare supplement, and quite frankly, it's almost cost prohibitive to have a Medicare supplement. In this range, you're going to pay $300 to $400 a month for it, depending on the state and the plan that you choose. If he can get a plan, many states don't even require insurers or insurance companies to offer Medicare supplements to disabled people or people under 65. People that are retired and over 65 have a lot more protections in place for them instead of this gentleman. So he didn't have a Medicare supplement, and he was going right off of Part B. So whatever the cost of the drug is, Medicare will pay 80%. This gentleman would be responsible for 20%. For him, that 20% worked out to 10 grand per month, which is a pretty large number to hit. So that's kind of where we're at. He's on Part B. He's paying 10 grand a month for his drugs. It's becoming a financial death sentence for him, as you can see here. Switching from D to B, what could be a financial death sentence for this gentleman. For most people that are on Medicare, they have either a Medicare supplement or a Medicare Advantage plan. And people that would need that have one of those plans, would actually benefit from it being on B versus D. And here's why. Your Medicare supplement, most of them after you pay the deductible for Part B, which is $270 for 2022, would be covered 100%. So his drugs would be, that $10,000 a month would be paid by the insurance company. Number two is if he were to have a Medicare Advantage plan, he may pay that 20% for the drugs each month, which would have been possibly $10,000. But Medicare Advantage plans for Parts A and B services have a maximum out-of-pocket cost. He wouldn't have that under Part D. He would follow the Part D, which is the drug plan tiers. But under Part B, he has a maximum out-of-pocket cost, and that can range anywhere from $2,500, and I've seen it as high as $8,000 or a little bit more. So he would pay more out of pocket, but he would only pay up to that maximum out-of-pocket cost. So let's say it's $5,000. The first month he would pay $5,000, and then for the rest of the year, the insurance company would pay 100% because it's under Part B. And that kind of leads us to what my suggestion would be for this client. He's saying here that he's looked into Medicare supplement insurance, but says that nothing he could qualify for would move the needle on the price. He's absolutely right. If he could qualify for anything, and that's a big if he could qualify from anything, it probably wouldn't cover him, just because of the cost, and also it's hard for me to imagine what he would be able to qualify for because he's already spending $10,000 a month. The insurance company is not going to trade a $300 a month premium for a $10,000 cost. They're just not going to do it. And so, unless you're already under insurance. So in his case, he probably didn't qualify for much. On the other hand, he could sign up for a Medicare Part C plan, which is the Medicare Advantage plan, to get that maximum out-of-pocket benefit. And what that would do for him is it would significantly decrease the amount of money that he would pay per year for his drug. And he can actually do that annually during AEP. And they can't deny him. There's minimal health questions. So for him, there's almost no chance of him being a denial. That would be my suggestion for him, that if he is going to have Medicare, he needs to be on a Medicare Advantage plan. That's in his best interest. If you like this content and you'd like to see more of this as opposed to the explainer videos that I do, please leave a comment in the comment section. Don't forget to like, subscribe, and hit the bell notification so you're made aware of when I post new videos. Thank you so much for your time. Don't forget to check out travisprice.com/turning65, where we answer a lot of the most common questions about Medicare and Medicare private insurance. There are videos there. There are links to other articles. It's a really great resource. And have a great day.